The first ever malaria medication for children under 5 years of age has been approved and will soon be released in about 8 African countries. Good evening. Welcome to Sound Health on Lagos Television. I am Olasumbo Mudukwe. Today we are going to find out what makes this medication for children under the age of 5 different from the usual malaria medication and how it's going to protect the vulnerable. Stay tuned. The conversation begins after this break.
Some threats aren't obvious. In our homes, our communities, our cities, they're always among us, often unseen, hiding in plain sight. Non-communicable diseases like cardiovascular diseases, certain types of diabetes, cancer, chronic respiratory disease can affect us quietly. And every year, they take millions of lives. Most often, they are influenced by the world around us, factors outside our control. But the power to prevent and manage them is in our hands. Change isn't only possible, it's already within our reach. By addressing the underlying health and risk factors, by meaningfully including people living with non-communicable diseases into decision-making, understanding how environments and policies put us at risk, by supporting bold, inclusive non-communicable disease policies like high taxes on cigarettes and other unhealthy products, decreasing the salt and fat content in our food, and ensuring access to essential medicines, we can build healthier futures for everyone.
The program is still Sound Health on Lagos Television. Joining us now to share more expertise on the recently approved first malaria drugs for babies under 5 years of age is pharmacognosist Oyindamola Awoshola Fadolapo, and she is going to tell us what makes the malaria drugs for babies different from the usual malaria medication we have out there. Good evening, pharmacognosist Oyindamola Awoshola Fadolapo, and thanks for joining us.
Good evening, thanks for having me.
All right, so tell us, how did you take the news of the approval when you got to know about it?
It's one of the best things that can happen to us right now in Africa because malaria actually kills a lot of children under 5. Aside children, also adults. But this medication is important now because children that babies that weighs less than 4.5 kg can actually take malaria medication and get better from the cause of the effect of the malaria parasite.
Okay. Everybody will wonder, why would a child under 5, baby, an infant, be treated for malaria when such babies should be also, when such category of children should be protected instead of being administered malaria medication?
So, malaria is endemic. It's something everybody believes that once their baby is ill, it's malaria. Why? Because we have Plasmodium falciparum in Africa, we have it in Nigeria. Almost in every household, we have malaria biting hard. So ignoring this set of children who are here to thrive, who are here to live their life, and also help Africa become great is one of those things that shouldn't occur in our society. We should understand that if this is endemic, it will affect life across age. So babies also have the right to be treated, and they have the right to live if at all they have malaria.
All right, so what makes these sets of medication different from the normal malaria medication?
Okay, firstly, when it comes to pediatric suspensions, they are usually sweet. But the difference with this one is that it can also they are flavored to taste so that children would take it gladly. It's palatable. So the difference between this present one and everything that has been in the market for children before is that it can be dissolved in breast milk. In rural areas where they have they do not have access to quality water. Yes, the water might be tasteless, it might be odorless, but there are some impurities that could be in water. So breast milk is a standard food for babies, that are less than 6 months, and even children. It has a sweet sherry flavor, so it's going to be palatable to these children to take, and there's going to be reduction in, am I sure that my baby is taking the right water in this formulation, since breast milk can act as the liquid that this medication is dissolved in.
Okay, until now, there were no approved malaria medication, and according to your response and the World Health Organization, this particular medication weighs less than 4.5 kg. Many mothers or parents have also been worried about the potential risk, the components, and all that. I think you should address that now on this show.
Okay, the active ingredient in this medication is also artemether and lumenfantrine. It's something that has been existing and have been used to manage malaria. The difference is that this is age and weight specific. It's for children that are under the age of 5. For babies that are weighing less than 4.5 kg, they can also take it instead of getting to use the formal formulations for adults and trying to rationale this to okay, this baby should be able to take it when that situation occurs. This one is specifically suited, approved for babies. So there's no risk of, okay, this is a exactly new existing product. Is ACT that is also in it. It's just that they adjusted it, to a ratio strength so that this can be used at the exact amount, the exact dose for babies.
All right, each time I take malaria medication, just as other members of the public, malaria medication messes up with everyone's system, before it's, you get acclimatized to the medication during the dosage period and all that. Are we sure that this is not going to be encountered by these babies? Can you also allay fears of mothers and parents out there on this?
Well, here's what I would advise. Every adult who goes to the hospital uses anti-malaria, right? There's the normal thing is all drugs are poison, but not all poisons are drugs. So there is nothing without a side effect. However, when the side effect is lower than the potential risks, the adverse effect is safe to save your life, save the children. So this would act fast instead of waiting. Why? Malaria can kill. So why not try to take malaria out first before thinking of, is there a potential risk? Okay, yes, this study has already passed clinical trials. It means that they have checked what risk it could have on these children. Does it outweigh the potential benefit? That's the right word. So if the potential benefit outweighs the side effect, I think it's safe and it's advisable for mothers, for parents to administer the medication to the children.
Okay, so at this point, I also think you need to emphasize on the burden of malaria in Nigeria and sub-Saharan Africa, because many people still wonder, malaria, is it not just mosquito bites? I know the
Okay,
World
but
Health Organization says about 3 children die in 1 minute as a result of malaria. Can you please let us know in layman's terms now, what is malaria and how is the burden affecting us in Nigeria and Africa?
Okay. Malaria is an endemic disease. Like it's endemic in Africa, and it is caused by Plasmodium. So we have the deadliest guy, who is Plasmodium falciparum. So this Plasmodium is carried by mosquitoes, right? So then when mosquito bites us and they release this guy, which is the parasite, into our bloodstream, then this parasite begin to develop in our bloodstream and cause us to have malaria. So now that the malaria is already in the system, people begin to come down with different symptoms and signs. So aside the signs and symptoms, people die from malaria, and it's not new that people die. Like 1 in 3 children die in every minute, right? So the burden of malaria is just beyond the tag, I have malaria. There are, aside from the economic importance, it is also important to look at malaria from the point of, can it cause death, can it not cause death? If it can cause death, then it is important that we ensure that we have a malaria-free Nigeria and a malaria-free Africa by taking decisions. Number one, mosquito treated net to chase mosquito. It needs, to be fought. And there are several methods to fight it: prevention and treatment. They are using mosquito repellent, treated nets, to prevent the bite and mosquito from biting us. Then also medication. Now that babies will now have access to these medications that are in the market, the ACTs in the market, it's a very good development to Nigeria and to Africa at large. It means that we will now have safer countries with less malaria issues.
All right, thank you so much for that explanation. So, prior to the approval of this medication for babies, there were already growing concerns of resistance to some anti-malaria medication, Artemisa and all that. Are we sure we are not going to be experiencing that in the long run?
Well, when it comes to antimicrobial resistance, there are a lot of factors to it. If there's a resistance, there are different things. For example, misuse, overuse of this medication. Like I explained earlier that in almost every household in Nigeria specifically, once one person is down, everybody assumes it's malaria. So it's best to treat malaria with the right diagnosis. Ensuring that people are tested before beginning to take medication is very important, because we have access to this medication, a lot of people abuse this medication. That's first. Then on the hand of microorganisms also have the grace to adapt, right? Just like human being, adaptation is a characteristic of a living thing. So they begin to build resistance to some of this medication even before they are in the market. So, but the best way to deal with this, like I said, is not to misuse any of this medication.
Okay, many will still wonder how safe are these medications for our babies. You mentioned in your response earlier some of the points you raised. You advise that we use insecticide-treated nets. Are there other preventive measures, and how safe are these medications out there, the medication that will be rolled out soon?
Okay, like I said earlier, these medications are not, the medication for the babies are not exactly new. They are only new to babies, right? So it's something that adults have been using, younger children have been using. It's just that this is specific. This one is specifically also made for babies. So the concerns of the safety, the effect of this medication is lesser to the potential benefit. And this medication has passed the phases of clinical trials. It means that they would have checked the potential benefits and the potential side effects. So once the potential benefit totally outweighs the side effect or any risk, it is safer to administer this medication to any group or groups of individuals who are affected by these issues.
All right, your final words as we wrap up pharmacognosis, Oyindamola.
Okay, malaria kills 1 to 2 children every minute. It is important that parents are proactive, ensure that they get the proper diagnosis for their children, and also treat every medication as poison. Like I said, every medication is poison, but not all poisons are medication. So it is safer to get your diagnosis from a doctor, and ensure that you prevent the rot of malaria. We have a safer country and a safer continent with that. Thank you.
All right, prevention, they say, is better than cure. Even if you're using any medication, it should be with caution. Pharmacognosis, Oyindamola Awoshola Fadolapo, thank you so much for your time and expertise on the recently approved malaria medication for children under 5 years of age.
Thank you for having me.
You're most welcome. I have been speaking with the pharmacognosist Oyindamola Awoshola Fadolapo on the recently approved malaria medication for children under the age of 5. Sound Health continues with trending health report from around the world. Please stay tuned. You have been watching Sound Health on Lagos Television, and the topic in the last 25 minutes has been the recently approved malaria medication for children under 5 years of age. Malaria kills, but prevention, they say, is better than cure. Even if you're administering the malaria medication, it should be with caution. The malaria medication for these children will be rolled out before the end of 2025 in about 8 African countries, including Nigeria. Report symptoms early enough to the nearest health facility. This is why we say thank you on today's episode of Sound Health. For comments and inquiries, or you have topics you'd like us to treat, please send SMS to 0035 826603 or follow us on social media at Lagos Television, #Sound Health. A sound health is a sound mind. Make healthy living your choice.